Welcome to part 2 of the Heart Failure Academy series. In this section, we will talk about general health maintenance in heart failure, so how to be your best self. So we're going to talk about good health practices in general, and they'll help you take care of your whole self. So general health maintenance, it is important to see all your providers regularly, including your primary care provider, and any specialist you may see. These include things like your cardiologist, your nephrologist, pulmonologist, and any other specialist you may see. It is important to follow up with all of them regularly. It is also important to stay up to date with vaccinations. They will help keep you healthy. People with chronic illnesses are more likely to get viruses due to their weakened immune system, and being sick adds stress to your body and your heart. We recommend avoiding alcohol use as it is toxic to the body and it can make your heart failure worse. And also for some folks, this might be the cause of your heart failure. Next is blood pressure management. High blood pressure is important to treat because over time it can cause issues with your heart, vascular system, and kidney function. Many people don't have symptoms though when they have a high blood pressure, and therefore they're not really concerned with it because they don't think it's any big deal. But it is important to take all of your medications as your doctor has prescribed, and it's also important to monitor your blood pressure at home if your doctor has asked you to do so. If you're not sure where your blood pressure should be, ask your provider and they will let you know. Next is diabetes and weight management. Diet and exercise are very important for both. Obesity and uncontrolled diabetes can damage every organ in your body. Blood pressure and cholesterol control is critical for both of these conditions. If you're a diabetic, you want to make sure your blood sugars are well managed. And if you're needing help managing either of these conditions, contact your primary care provider. Sleep in your heart. Lack of sleep can contribute to high blood pressure, a slowed metabolism and weight gain, which then can contribute to diabetes, and it also leads to poor decision making. If you're someone with sleep apnea, it is a condition where the airway becomes restricted or blocked during sleep, and this can occur throughout the night, resulting in disrupted sleep. Sleep apnea can lead to high blood pressure. It increases your risk for abnormal heart rhythms, decreases your quality of life. It can worsen your heart failure symptoms. Some symptoms of sleep apnea include snoring, daytime sleepiness, restless sleep, insomnia, loud breathing, and fatigue. If you're worried that you may have sleep apnea, contact your provider so you can be screened. ICAN is CHI's tobacco cessation program. All forms of nicotine are bad for you, whether it's smoking, chewing tobacco, e-cigarettes. We highly encourage you to avoid all of them. Quitting is very hard, and oftentimes both counseling and medications are needed to be successful. The CHI tobacco treatment programs are designed to educate, encourage, and support tobacco users wanting to quit. If you need assistance quitting, here's a website you can visit to help you, or you can contact your primary care provider. Stress management. Stress is defined as the physical, mental, or emotional strain that affect your ability to function in a normal way. Some stress that we experience can be helpful, but excessive stress can lead to physical and emotional exhaustion, serious illness, and lead to poor decision making, such as poor eating or drinking. High stress can lead to health problems such as high blood pressure, stomach ulcers or gastritis, fatigue, poor health decisions, anxiety, depression, and it can worsen your heart failure symptoms. So some ways to reduce stress. First, identify your stress and learn what causes it. And if you're able, try to avoid that cause. Regular exercise is important. Doing something you enjoy every day, even if it's only for 5 or 10 minutes. Laughter is great medicine. On average, kids laugh about 300 times a day, and usually they're pretty happy. Compare that to us adults, maybe 15 times a day. Also learn to manage your time, make reasonable to-do lists. Learn to say no. If somebody's asking you for help but you're already struggling, it is okay to say no. But on the other hand, if you're doing good but you know somebody else is struggling, go ahead and reach out to them and see how you can help them. It's important to stop negative or bad thoughts and also make time for family and friends. Next, we will talk about depression. Research has shown 1 in 10 American adults and 33% of those with a heart failure diagnosis suffer from depression. Depression can worsen your physical symptoms. Some signs that you might be experiencing depression include loss of interest in your normal activities, sleeping or eating changes, feelings of sadness, of hopelessness, anxiety, more tired or lack of energy, and trouble thinking or remembering. Now, with a heart failure diagnosis, this brings on many feelings, especially fear, grief, and loss, both for the person with heart failure as well as for their family. This is a normal response, and the best treatment is medication and counseling together. This will help increase energy, activity level, and quality of life. As the quote states, pain is inevitable, suffering is optional. Please reach out to your provider if you feel like you need help. There's some resources as well on this slide you may reach out to. So let's recap general health maintenance. True or false? Smoking is the only form of tobacco that is bad for your health. This is false. All forms are bad for you and should be avoided. Number 2, does sleep quality affect your heart health? Yes, absolutely. Poor sleep can worsen your health. Then lastly, true or false? Heart failure is not affected by diabetes or being overweight. Again, this is false. Both of these conditions can worsen your heart failure. This ends part 2 of the Heart Failure Academy series.